So welcome everyone, good morning. This is the second lecture of this week. And today's topic is all about health risk perceptions. So to get us started, 1 in 2 Canadians are expected to get cancer during their lifetime. So I wanted to ask you guys, what do you think the odds of a woman are of getting breast cancer here in Ontario? Just as a guess. So some of you are saying 1 in 3, Reed says 1 in 4. Anyone else have any other ideas? I think most of you are saying 1 in 3 or 1 in 4. Lisa says 1 in 8. Well, Elisa, you got it right. So it is actually 1 in 8. And I like to use this example a lot whenever I talk about health risk perceptions, because I think especially when we're talking about something like cancer, it really does kind of show its relevance, this idea of how we perceive risks might not always line up with the true probability of risks in the reality. So sometimes how we think of ourselves and our risk of getting something or our risk of being exposed to a hazard might not always align with the true level of risk. So we'll kind of talk about that today and how this relates to health psychology, some of the things that we were talking about yesterday. Just as a kind of FYI, in comparison, the odds of dementia among Canadians is about 1 in 4. And yet, I think most women in Ontario are probably far more concerned about their risk of breast cancer compared to something like their risk of dementia or other diseases, which are also very common. So again, this kind of psychology of disease, health risk perceptions, this all can tie into how we think our risk of certain diseases might play out. So that's a little introduction to today. Now, I want to do a quick recap from yesterday when we talked about these behavior change models. I know we covered a lot of ground, so hopefully this will serve as a little refresher. So we talked about 3 main models, and the first one was the health belief model. We talked about the social cognitive theory. We also talked about protection motivation theory. So this theory is particularly relevant to the things that we're going to be discussing today. So I wanted to kind of refresh what we said about it yesterday. So remember that protection motivation theory was the one where an individual is essentially appraising their threat or their level of threat towards some hazard or health outcome. And that is one of the pieces of the puzzle in terms of how they decide to take an action or whether they decide to change a behavior. It's based on the level of threat that they perceive, as well as how they think they can cope with that threat. So there's a key aspect of that, people need to believe that there is a threat in order to act. People need to believe that a risk to themselves is there in order to act. So that kind of plays into how people appraise those threats to health. It's how they make a decision about a level of risk that they see happening to themselves. So what is a health risk? Let's refresh that, because I think it's been a while since we talked about health risks and really defined them. We did that back in the second week of the course, and we defined health risks as the chance or the likelihood that something will impact our health. But do people perceive a risk to their health purely by the event's probability? Well, I think when we did that exercise with the odds of breast cancer, maybe we've come to realize that how we perceive a risk is actually not just based on the probability of it happening or the likelihood of it happening, but there are other factors that go into it in terms of how we think about a risk or the likelihood of us actually being affected by a particular risk. So there's a diversity of risk perceptions that end up happening. People can, in fact, look at the same scenario, the same risk, and think that their risk varies widely compared to another person. Now, why is this? Well, the outcome of different health diseases, health outcomes, these obviously vary by certain risk factors. Remember, there's a multitude of risk factors that impact someone's likelihood of having a disease. Let's say it was something like cancer, things like diet, things like physical exercise, things like that. And because people may have different levels of interaction or exposure with some of those risk factors, of course, naturally, their risk of a disease will vary. And so that also kind of plays into how people might perceive their risk of something happening, of some health outcome or disease happening to them. So remember that when we talk about health risks, a health risk is technically the chance or the likelihood of something impacting our health, but the risk perception is not just taking into account the probability, because that would be a very rational kind of approach when we talk about risk, when in fact, people do have a much more kind of nuanced view about health risks and how they perceive a risk to be towards themselves or maybe towards other people. Now, an example of this is risk perception of climate change, which is, of course, a pretty big public health emergency at this point. And so just to sort of illustrate the fact that many factors influence risk perceptions, well, we could take a look at these kind of cognitive, psychological factors, how those impact people's knowledge about climate change, and that might impact their risk perceptions of it. Some of those sociocultural influences, which we touched a lot on yesterday when we were talking about health psychology, those of course play a role in influencing how someone might perceive a risk, how they approach the level of threat from a particular risk, and of course some of those socio-demographic factors. So we're going to dive into some of these factors and take a closer look at how they actually impact risk perceptions. So the first one, demographic factors. Gender is a particularly interesting one when we're talking about risk perceptions, because concern about harms to health and well-being usually tend to be higher among those who identify as women. Let's take a look at, again, a climate change example. So the perceived harms from climate change and specifically, if you take a look at this figure, what's interesting to note is that women and men, so both of them seem to understand that global warming, climate change is real. So they have similar perceptions around the threat in general. But where they really differ is when it comes to things like worrying about climate change, as well as the level of harm. So the threats that would arise from global warming or from climate change. So that's really where women tend to have higher risk perceptions. They perceive the threat from climate change to be higher, specifically related to concerns and harms that might take place because of global warming or climate change. Now, what's interesting as well is that in particular, white males seem to have a particularly low risk sort of perception towards many risks or threats. So this is in comparison to females as well as people of color. And for some reason or another, apparently white males tend to perceive very few things as risky to their health. So it's kind of interesting to note. Now, some other important demographic factors, I think most of us are pretty familiar with these at this point. So things like income, education, and age are, of course, also really important in terms of their influence on perceptions of harm. So taking a look at this example, this is a study that looked at the perceived harm from nicotine in e-cigarettes, and specifically they were looking at youth. So how youth perceived those risks to their health. So one thing that the study's authors found was that those in the older age youth categories tended to perceive the harms as higher compared to those younger youth. Also worth noting is that those who were in a lower income household tended to perceive the risks from nicotine as being lower compared to those who were from a higher income household. As well, the education of their parents seemed to influence their risk perceptions towards nicotine. So specifically, those youth who came from households with parents who had a lower educational attainment, those were the ones that tended to also kind of underestimate or have lower perceived risks of nicotine in e-cigarettes. So what does this tell us? Well, that of course, many of these factors are really important, but also given what we know about some sociocultural factors and their influence on risk perceptions and how we approach decision-making around health, perhaps it's not surprising that perhaps an influence from parents or from families, our household, might also kind of play into that. So it might not just be our own individual demographic factors, but also kind of the social and peer surroundings that we surround ourselves with. Now let's get into some interpersonal factors. So individual trust in our values really influence the perception of how we analyze the costs and the benefits associated with particular risks to our health. So what that means is that many of these trust and value factors influence how much we're willing to tolerate a certain risk. So whether we're willing to kind of put up with a risk, even if we might know that it could be dangerous to our health. So that's kind of how that plays into it. And perhaps unsurprisingly, the oil or the energy industry tends to be consistently ranked among the least trusted industries throughout the world. Certainly here in Canada, I think there is quite a bit of distrust towards oil companies, oil sands, tar sands, whatever you name it. And so a lot of this distrust in the fossil fuel industry does actually come into play when we're talking about health risk perceptions. Particularly, think about any time there's an oil spill or any sort of environmental health hazard, maybe it's pollution from an oil refinery. Those types of pollutions or those types of environmental risks tend to be really, really untolerated by people, particularly in surrounding communities. And a lot of that plays into it because they don't trust those industries. They don't think that they're always telling the truth. They think that they're hiding things. And so that really helps to kind of exacerbate the level of threat that people feel from those industries. So how else does this play out? This was a study that looked at people's perceptions of conventional fuels, so things like gasoline, petrol, compared to CO2-based fuels. Now, CO2-based fuels are things like carbon capture technologies, biofuels like from ethanol. So those kind of still carbon-based, but alternative carbon fuels compared to those conventional fossil fuels that we are more familiar with. And so how did people perceive those differently? Well, again, perhaps unsurprisingly, people tended to think of CO2-based fuels as more safe, more harmless. They tended to view traditional fossil fuels as more risky, more dangerous, more polluting, more toxic to their health. And so again, this kind of plays into that trust because people really tend to distrust some of these industries. It shapes how they view the risks to their health coming from those industries specifically. And this plays out as well with a lot of chemical pollution. I think in the previous little, if I can go back here, chemical industry as well is among the least trusted. So again, unsurprisingly, many people tend to exhibit some skepticism, some alarm anytime they hear of chemical pollution in their communities, because again, that level of trust isn't there. And that really plays into people's fears and their concerns and their perceived level of risk from these things. And I should note that, in fact, so this was a study about the life cycle emissions from biofuels like ethanol compared to conventional gasoline. So when you look at the entire life cycle of emissions, the ethanol actually turns out to be worse for pollution compared to conventional gasoline. So again, this just goes to show that not always do those risk perceptions align with the true kind of risk of the situation or the scenario. So many times our risk perceptions might actually go against the actual risk or the actual probability of some risk to health. Now, the third factor are these sociocultural factors. So this includes things like religion, people's worldviews, social norms as well in societies, and a lot of the social and cultural institutions that influence people's level of perceived threat from a given hazard or from a health outcome. So for example, this study looked at collectivist versus individualist societies and how those differences in worldviews could translate to how people tolerate and manage risks differently. And specifically, this was a study looking at their intention to take on preventative measures related to COVID. So what they found was that those coming from areas where there tended to be higher collectivism, so more kind of together societies, really pushing for a collective, those were the ones that tended to be more willing to take on preventative measures for something like COVID, whether that was masking or other public health measures, in comparison to those more individualist, lower collectivist areas. But what's worth kind of pointing out is that they found that in situations where the individuals had a high amount of fear towards COVID, that is a situation where they actually exhibited a similar level of willingness to take on a preventative measure or to change their behavior. So what they hypothesize here is that maybe certain situations, particularly fearful or concerning situations, can actually kind of equilibrate the difference between collectivist and individual societies. So people might actually end up making similar decisions if they're put in that kind of a situation where they really fear or they have a high level of concern that might influence their risk perception. Bye, Regina. Thanks so much.
Hi, everyone.
Okay. Now, another thing that influences health risk perceptions is geography and location. So again, maybe unsurprisingly, rural and urban differences in risks. We know that people in rural areas compared to urban environments have different risk factors. So that might also translate to different perceptions of risk based on those differences in probability of getting a certain disease in one place compared to another. But also there's differences in perceptions when you compare different countries as well as different regions within countries. And these are likely mediated by more sociocultural differences. So again, those worldviews, perhaps different ideologies, different gender, things like that. But I think it's worth kind of noting here in this figure. So this was a study that was looking at the risk perceptions specifically related from heat. So heat risk perception related to climate change impacts. So what they found was that those in many of the southern states, so places like Texas, Oklahoma as well, some of those more southern states, they found that people tended to have a really high risk perception related to heat waves, heat events from climate change. And they were, pleased to see that because, in fact, those are areas that are going to be particularly at risk of having more heat waves, more heat-related events due to climate change. But what the study authors also noted was that in other areas, people tended to underestimate the risk to their health and to their kind of well-being based on heat-related adverse events from climate change. So particularly in places like the Rocky Mountains, people tended to really underestimate the risk that climate change will pose when it comes to future heat-related events and how that will play out in the coming decades. So again, people's level of perceived risk can vary drastically by geography, by different areas, and it doesn't always match up to that real, true kind of probability of what is likely to happen in terms of the risk. Now, another influence on health risk perceptions are these psychological and cognitive factors. So this just means that the way that people's mind processes information, this will impact how they perceive a harm from a particular hazard. So remember that we talked about those behavior change models yesterday. Well, this kind of ties into that because before you even decide to change your behavior related to some action or some intervention, let's say in public health, you have to process a health risk and your brain kind of has to decide that it's worth making a decision. It's worth changing your behavior because the level of threat is high enough or it's severe enough that you need to kind of perceive that risk to be high. So thinking about that, how does our brain actually assess the level of risk from a hazard? How does that happen? So there's a few different psychological and cognitive kind of factors related to the hazard. Now, what I mean by that is humans are particularly uncomfortable with uncertainty. So anytime there's a hazard or a health outcome that is really uncertain, those are the ones whose risks we tend to perceive as really high. Those are the ones that we tend to fear and that we're often most concerned about. And a lot of this makes sense because in an uncertain situation, it's often that we don't have enough information to really feel reassured about a particular risk. So it does make sense that, high uncertainty situations are those situations that we tend to perceive as really high risk or really concerning. So looking at this figure here, again, based on kind of the opening exercise of today's lecture, perhaps it's unsurprising that cancer comes out as top. People tend to perceive it as really uncertain, and that tends to really fuel people's perceptions of cancer relative to other diseases that are also very common diseases, but maybe people are a little bit less fearful of them. Taking a look at another one of these cognitive factors is related to control. So hazards that we can't control or that we view as involuntarily imposed on us, those tend to be the ones that are perceived as more harmful compared to hazards that we can control. And so this can be witnessed whenever you compare people's risk perception of certain transportation choices. So just as an example, arguably it's much safer to go travel by airplane compared to something like a car or a motorcycle if you're talking about risk purely from the standpoint of the likelihood of getting into an accident, let's say. However, people do tend to have a fear of traveling by planes. That tends to fuel a lot more anxiety compared to something like traveling by a car or other mode of transportation, because we're not the ones in control. If something goes wrong in an airplane, we're not going to be the ones to fix it. Also, I guess the likelihood of death is probably higher compared to something like a car where you're much more likely to survive an accident. But again, this kind of plays into that level of control and how we try to avoid situations that are out of our control. Those are the ones that we tend to not tolerate very well. Now, you can also think about this from the perspective of the workplace or any other sort of situation where we're interacting with people. Those situations are ones that tend to put us at ease. For example, working in a workplace, if you know that you can feel safe, you can wear personal protective equipment to maybe protect yourself from something like COVID. Those are going to be situations where you're much more likely to tolerate a risk to your health compared to, let's say, an environmental pollution situation where, again, you're not the one in control. This might be happening to you due to some industry that you don't trust. The threat is really being imposed on you. You didn't ask for it. You can't really refuse it, and you certainly don't benefit from it. So all these things, all these factors really come into play when we talk about control and involuntary risks. Now, another one is related to actually who is affected by the hazard. And so this impacts perceptions of harm because, again, that kind of control factor, that involuntariness is really the focus. So just as an example, anytime we talk about risks to younger children, those tend to be really risks that we are absolutely not willing to accept. Those are the ones that we really don't want to tolerate in our society because, again, we view children in a very different way compared to adults. The risks imposed on them are viewed as very involuntary. And so those are the ones that we want to avoid. Those are viewed as very high risk. And certainly the fatality of a hazard also plays into these perceptions of risk. So anytime you want to compare something like radiation coming from a nuclear disaster compared to something like an X-ray, people perceive the risk of those two things very differently, even though inherently the type of hazard it is actually quite similar. The main difference, however, is that, of course, if there is a nuclear disaster, you're much more likely to experience fatality or more significant kind of health consequences. And so the consequences of that hazard are really what play into that, and how likely it is that you might survive an accident, for example, really plays into your perception of risk related to a particular hazard like that. So I want to take a step back after kind of bombarding you with all that information and ask you guys, what do you think has impacted perceptions of risk on COVID-19? I think we can all agree that people's level of perceived risk from COVID is quite different. Someone might perceive risk to be really high, others might perceive it to be quite low. So I'm curious, what do you guys think is going on related to these risk perceptions for COVID? What do you think has impacted those perceptions? So Abby says the risk of fatality. And what do you mean by that, Abby? Do you mean a higher risk of fatality means, so those who are maybe at risk of the fatality view their personal risk as being higher? And then Emma says demographics, so living in multi-generational homes. Yeah, the people who are, oops, people who are more affected are often older with predisposed health conditions. Yeah. And then Abby, so lower risk. So those who are not vulnerable aren't as concerned. Yeah, so certainly the younger age individuals tend to be a little bit less concerned. Having to leave school made the risk pretty real for me about a year ago. Now the risk is more centered around putting your family. Yeah. Savannah says uncertainty. A lot of people experience it differently. Certainly, yeah. Most people haven't had COVID-19 before, and while we know what the symptoms are, we don't really know the severity of how it will impact us. Yeah, exactly. Lack of control. Yeah. Yeah, so a lot of these factors that we just talked about certainly are relevant to talk about in the context of something like COVID. Specifically a year ago when this was also new, you guys are totally right. It was a lot of uncertainty, feelings of not really knowing how to cope with the risk. That was really kind of at the forefront of people's risk perceptions and their level of fear from it. Reed says some people perceive COVID as more of a risk to their freedom. Yes. Yep. And we'll talk about that in a moment. Anyone else want to chime in? Also, sometimes young people hear that COVID won't affect them. I know some people have gotten in really downplayed the risk. Yeah. Yeah. So unfortunately, our information streams as well have sometimes been impacted and may influence our perceptions of the risks. So let's talk about some of these. So something we haven't really talked about, but I think is really, really relevant to discuss related to COVID is the politicization of risks, because this is a pretty new phenomenon, I think, that really has emerged out of COVID and maybe wasn't a dominant factor for risk perceptions before this. So political ideology has had a really impact on the risk perceptions of COVID, specifically in some countries, thinking about the US in particular. So I think it's interesting that a lot of studies have come out to show that those who are Republican leaning, more on the kind of conservative ideological spectrum, are the ones that tend to really have lower perceptions of risk related to COVID-19. Even though, of course, COVID doesn't strike based on your political party lines. Really, anyone could be at risk of getting it. And certainly those who are most at risk of a fatality from COVID are some of those groups that you guys identified, the older age individuals, but also people with certain predisposing health conditions. So I think it's interesting to note that these divisions seem to happen across those political party spectrum lines, even though, of course, we know that the risk isn't separated by those ideologies. So what do you guys think has influenced those particular risk perceptions? Why would someone who's maybe on the Republican political spectrum, so more of that conservative spectrum, why would they have lower perceptions of the risk? What do you guys think? Are there any aspects of maybe their political ideology that tie into certain worldviews, for example? So Lisa says pandemic. Yeah, so there was some conspiracy theories that maybe early on kind of influenced people's perceptions of risks. Anything else? anyone else want to guess what might be going on? So why might certain political ideologies influence those perceptions of a risk? People who lean right politically tend to be individualistic, while most of the advisories relating to COVID all protect the collective. Yeah, Esme, that's a really great point. So consistent with the more kind of conservative, right-leaning political ideology that really does tend to focus on individual liberties, personal freedoms. It does kind of go against a lot of those public health measures that are really advocating for protecting a collective of people. So certainly that would tie into that. And of course, I think something that is perhaps unique to the States, although maybe no longer that unique to the States, is really the difference in information channels. So yeah, Nima, you just mentioned Donald Trump says nonsense to people. Yep. So Donald Trump, and certainly the whole kind of institution around a lot of the right-leaning media corporations in the States early on, I think, established certain opinions about the risk to health from COVID. And so that, again, may have played a role in aligning certain people who consume those media outlets. It may have influenced their perceptions of the risk based on what they were hearing and learning about COVID. So yeah, a lot of these things kind of tie together. So related to that, misinformation. Unfortunately, we've never really had to deal with this kind of level of misinformation before during any previous really public health kind of emergency situation. But it's worth noting that not all misinformation is the same, and not all misinformation is totally fake, totally bogus, easy to recognize. So in fact, this was a study done by the University of Oxford, and they were looking at a random subset of social media posts from tweets, YouTube, as well as Facebook. And this was early on during the pandemic, so almost a year ago, last kind of early spring. And what they found was that, in fact, the most common type of misinformation that they found was posts that tended to be reconfigured. Now, this is potentially problematic because these posts were not always completely fabricated, right? So they weren't always easy to recognize as being totally fake. Many times they just had certain words reconfigured. Sometimes they had images that were a bit altered or maybe taken out of context. Maybe it was an image from actually several years ago, but it was being used to perpetuate some kind of myth related to COVID today. And so a lot of those posts could theoretically maybe be perceived as true to some people who are maybe not actively looking at it or actively engaging with the content. And so certainly it has the risk there of potentially misinforming people if they are taking it at sort of face value as truth and not really digging deeper to see what's going on. Now, the topics that were most likely to be misrepresented were actually those that were posted by public health authorities. So actions that public health authorities were putting out, whether it was directives about masking or other kind of public health measures that they were trying to inform people of taking. So why is this problematic? Well, because many of us throughout this pandemic has relied on posts like that from our medical health officers, our ministers of health, depending on where you live and kind of how the jurisdiction of health is set aside. We really rely on a lot of those kind of experts, maybe some of those bureaucrats who were put in charge of telling us how to lead our lives, telling us how to perform certain actions, or maybe change our behavior in ways that would minimize our risk. So the fact that those were the tweets that were kind of actively being targeted for misinformation is definitely a concern because, again, that could really lead to a lot of confusion. And certainly, we were seeing enough mixed messages from a lot of those public health posts as it is. So as soon as you start adding some misinformation into the mix, then it really just becomes kind of a chaotic communication problem. And so why are we concerned about this? Well, I think it's interesting. Carleton University actually did a bit of research onto how Canadians were perceiving some of those conspiracy theories that were coming out in kind of the earlier stages of the pandemic. And so what they found related to, for example, the 5G conspiracy was that, you know, a surprising percentage of people did actually believe that COVID wasn't a serious illness, that it was being spread to cover up those harmful effects from 5G technology, particularly among those who do tend to use a lot of social media, right? So the younger kind of under 30 age category. So that is something that's definitely concerning. Samima says, yeah, they definitely took too long before implementing the mask and social distancing policies. Yeah, so some countries took a more preventative approach early on. Really, I think approaches did vary quite significantly. So it is kind of interesting looking in hindsight, of course, what maybe could have been done, what should have been done differently. But keeping in mind at the time that we really didn't have a lot of information, it was such an uncertain scenario. So I think it's kind of tough to judge what a lot of those public health experts were doing and maybe what they should have been doing instead. But in any case, this is kind of the situation as it is today. So how do we fight this misinformation? Well, I'm sure you guys have heard that a lot of tweets have been banned, maybe certain Twitter accounts have been banned. Facebook as well has started to moderate some of their posts a little bit more. But it is really, really tricky to go and remove this content because, again, sometimes it's not easy to spot. Something might just be a little bit altered, something might be a little bit misleading, but it's not always blatantly false. It's not always easy to pick out that it's, fake news or something like that. So one other way would be to maybe increase the presence of public health officials online, but that also can be a little bit tricky. So this is actually a study that I was working on this summer, and I spent a lot of my summer looking at the tweets of public health officials here in Canada to see how they were communicating about the risks of COVID over the course of the earlier stage of the pandemic. And something that I found was that a lot of the public health Twitter accounts did do a pretty good job early on, right after the WHO declared a pandemic. So they did a good job of tweeting about how to control risks, how to manage risks related to COVID. But unfortunately, that seemed to really die down just as the active cases were going up. So interesting to note that, our communication strategy in public health certainly have a long way to go before we can maybe say with confidence that they're actively helping people manage their risks more effectively. They're helping to inform people about how to take certain measures. And this has proved to be a really, really important part of the pandemic response in today's context. So again, I hope that some of these principles from health psychology that we were talking about yesterday, behavior change, this does really tie into health risk perceptions. And that's why I think it's really important to kind of understand these two topics together. And in today's context, again, it's a really, really important part of designing any sort of pandemic response, whether that's developing communications or policies that are intending to shape people's behaviors based on perceptions of risk, and maybe helping people make decisions that are based on the real likelihood of something happening or something impacting their health versus maybe how they emotionally perceive it or otherwise. So really trying to match those risk perceptions to the level of actual risk. So with the last 10 or so minutes of today's lecture, I do want to talk about vaccine hesitancy, because I think it's, again, really, really relevant to discuss with what's going on today, given that most provinces in Canada, certainly here in Ontario, are really ramping up their vaccine efforts related to COVID, and why maybe we're seeing some pushback. So I do want to highlight that vaccine hesitancy, specifically around COVID, is not just a bunch of anti-vaxxers. So people do, of course, have legitimate reasons to be concerned about vaccines, as with any new medical device or new technology. Certainly that uncertainty plays into it, right? People are perceiving risks when they're unfamiliar with something, when they don't really fully understand something. And certainly this is true of any sort of new technology, like a new vaccine. And I think it's interesting to note that in this study from the States, where they were looking at different perceptions of risk from the COVID-19 vaccine, those, particularly in the high-risk groups, did cite some pretty high percentages of people who were hesitant. So even among essential workers, even among healthcare workers, close to a third of healthcare workers did cite some hesitancy related to taking that COVID vaccine. So this is definitely going to be an important issue to try to tackle. But it's worth noting that we've been here before. Anti-vaccine, vaccine hesitancy, this isn't new. In fact, a lot of this kind of anti-vaccine sentiment really started up in the Victorian era back in the 1850s. And so this was particularly in the United Kingdom after the UK passed its Vaccination Act of 1853. And so this particular Vaccination Act made vaccines compulsory for all young infants in their first 3 months of life. So mandatory vaccine programs are particularly those that are not popular, anything that's imposed, anything that's viewed as involuntary. Remember that tends to really push people's perceived risk kind of over the edge because they don't feel that sense of control anymore. So back then, vaccine opponents were really concerned about the infringement of personal liberties as well as vaccine safety, which I think are still really, really important issues that are kind of at the forefront of a lot of those vaccine hesitant or anti-vaccine campaigns. To be fair, back then, so I'm talking in the 1850s, the medical profession wasn't even fully standardized yet. So perhaps people had a reason to be a little bit skeptical of doctors and medical technologies back then, but certainly that's a very different scenario today where hopefully most of us do have a pretty high level of trust in our doctors, in our medical institutions that are there to kind of help us and heal us in times of medical illness or distress. And of course, this did happen in other places in the world. So even in Brazil and many other countries, there have been a long history of these types of anti-vaccine riots, particularly after a country tries to implement some sort of mandatory vaccination campaign. That's really when it tends to kind of bring the issue to the forefront. So what leads to this vaccine hesitancy? Again, people like to feel that they have agency or control over their health. So pushing any sort of mandatory vaccine is usually not very well tolerated. People tend to perceive the risk from those types of measures as being higher. So I think this has definitely played out early on in the sort of course of the vaccines. You know, there were a lot of polls going around asking people whether they think the vaccine should be mandatory. And usually a little bit more than half would say that they should, depending on the poll, depending on the country and the region. But it really does depend. And I think over time, certainly the proportion of people thinking that it should be mandatory tends to have gone down since the original kind of time that we were talking about these COVID vaccines. So what leads to this vaccine hesitancy? Well, again, that lack of control, that lack of trust certainly as well plays into it, because although many of us feel a level of trust in our medical institutions or our level of government, that is not the case throughout Canada. So if anyone is familiar with residential schools in Canada, those were those government-sponsored religious schools that isolated a lot of Indigenous children throughout Canada away from their families and tried to assimilate them into European culture. Now, unfortunately, there is a sad history of abuse in many of these residential schools, but something that has only started to emerge in recent years is that there were actually medical experiments that were conducted on some children in some residential schools. So one in particular was located in Kenora, so in northwestern Ontario, close to the border with Manitoba. At that particular school, a doctor and a nurse at a residential school actually experimented with 14 different drugs to treat ear infections in children at the school. And what ended up happening is that a bunch of those children later went deaf because the experiments were botched or they didn't end up working the way that they planned. So yeah, there is certainly reason for some historically oppressed groups, some marginalized groups to feel that level of distrust towards medical establishments, towards doctors in particular, because, you know, occasionally history has shown that marginalized people in particular have been sort of taken advantage of in this system, this institution. So definitely worth noting there. On the other side, what seems to be kind of a silver lining post American election is that the trust in the federal government there has actually improved since the inauguration. So after the COVID vaccine will become available, most people cited that they would in fact get it. And this had been a change since prior to the election. So more people are kind of trusting the establishments, more people are willing to change their behaviors perhaps, or take certain actions, which likely plays into that level of trust they have for those governing or social institutions. Now, what is the result of all this vaccine hesitancy? Well, you can probably guess that there has been a decline in a lot of vaccine coverage across many populations, and this has led to outbreaks of many vaccine preventable diseases, even here in Canada, we've had outbreaks of things like measles, mumps, specifically related to cases where the level of herd immunity was no longer reached in a particular community because so many people decided to avoid a vaccine or delay it or were hesitant towards it. And so today we're increasingly dealing with a lot of these types of groups, these organizations, these lobbies who are fighting for a lot of those medical freedoms. And, as much as we are a liberal democracy that does want to respect people's freedom, their freedom of choice, freedom of religion, all of these things, where does the line kind of fall when it comes to things like public health freedom and medical freedom? That's certainly going to be a very contentious area to debate in the coming years. What is whooping cough? So whooping cough is an infectious disease that I think most of us were probably vaccinated for in our very early childhood. It is, I'm pretty sure, one of the mandatory vaccines, certainly here in Ontario, that you have to take in order to be registered in public school. So whooping cough is it is a pretty severe cough. It is a disease that tends to infect especially younger children, and it can be deadly in younger children. So that's why they really have pushed for the vaccination of whooping cough. In any case, so going back to this COVID-19 vaccine, well, the risk of COVID-19 is generally underestimated compared to the risk of vaccines, which tends to be overestimated. And so that's really where we get some of these divisions of what people perceive the risk to be from COVID compared to what they perceive it to be from an adverse reaction from a vaccine. So this is just to kind of show you guys the data that I pulled from the Government of Canada's website, which is tracking actively the adverse reactions from COVID-19 vaccines. And what they have found so far, anyway, is that less than 1% of the doses administered have resulted in some sort of adverse reaction. So, take what you will from this kind of data, but certainly the probability of certain adverse health outcomes when you compare it to something like COVID-19 versus the COVID-19 vaccine, are hardly even comparable when you talk about the magnitude of the risk. But this can also, and I think someone asked about this yesterday, whether we're using health behavior models to understand vaccine hesitancy. So yes, there has actually started to be some research published about this, certainly even before the COVID-19 pandemic, but I think this will be increasingly used in today's context to really understand what people's behaviors, what their intentions are around vaccines, and what is really fueling a lot of this vaccine hesitancy. So I want to quickly end today's lecture with a moment to reflect. I found this article, which is published in Science magazine, and it's from over 100 years ago. So Science magazine actually published a paper on lessons from the Spanish flu pandemic. And if any of you guys are at all interested in this, I highly recommend you to go find this article, because I was just kind of transported into another world when I realized how similar the circumstances really are from today compared to 100 years ago. So the three main factors that this author found would stand in the way of the prevention of deaths and illnesses from pandemics are super relevant to discuss in today's context. So what the author summarized is that people don't appreciate the risks that diseases pose. They tend to minimize those risks. People also have a hard time restricting individual conduct in order to protect themselves and others. So again, kind of that individualist versus collectivist perspective. And also people often unconsciously act as a continuing danger to themselves and others. So even subconsciously, people don't always make the best decisions. They might be provided with tons of information, but again, humans can be very irrational. They can think about things and behave in very inconsistent ways. And so we can't always predict how someone might act in the face of something like a pandemic. So that article summarized or ended with, this may all seem very discouraging, but it need not depress anybody. The control of typhoid once seemed an impossible task. So the silver lining that although some infectious diseases do continue to present a real significant threat in terms of how we approach them, how people perceive risks related to them, there are other success stories of when we did manage to kind of get things under control and keep people safe. So hopefully that's some food for thought for everybody. So let's end it there. And yeah, let me know if you guys have any questions. Otherwise, enjoy the rest of your day.